Okay, wash my hands. Hi, Mr. Kawada. I'm Becca. I will be your nurse practitioner today. We are going to go over your medical history.
Okay.
So, what is your full name?
Okay, it is Joseph, Joseph, Wes, Wes, Kubota, Kubota.
Okay, and what is your date of birth?
September 7th of 1989.
Great. And what is your gender?
Male.
Perfect. Do you have any allergies?
I'm allergic to bees and maybe metal.
And what happens when you get stung by a bee?
It swells up like huge, and sometimes breathing is very difficult.
Okay, the area swells up, or what swells up?
Yeah, the area wherever I got stung swells up like twice the size, and breathing is usually difficult.
Okay, and have you ever had to go to the hospital for a bee sting?
Yes, sometimes it's not as bad as other times, but one time I had to go get a shot right after because I couldn't breathe.
Okay, do you remember how old you were?
Probably 13.
And tell me about what happens with metal.
With certain belt buckles, I'll get a big rash where the buckle touches my stomach, and it's just like a red rash, kind of bumpy, but it's with certain belt buckles.
Okay, perfect. And are you currently taking any medications or supplements?
Yes. I'm taking testosterone troches, and they have DHEA in them.
Okay, anything else?
Nope. Just normal vitamins.
Can you list the vitamins you're taking? Do you know which ones you're taking?
Oh, yeah. Just a B vitamin and vitamin D. I think that's all.
Awesome. And then do you know how many milligrams of testosterone and DHEA you're taking?
Yes, each troche is 50 milligrams of testosterone and 15 milligrams of DHEA in the same troche.
Okay, perfect. And what brings you in today?
I just needed a wellness checkup.
Okay, perfect. And when was your last wellness check? Do you know?
I don't remember, a couple years ago.
Okay. Do you know if you are up to date on your immunizations?
I have no idea.
Okay, we can check on that. Do you know the last time you got an immunization? How many years ago?
I really don't.
Okay. And so I'm assuming you haven't gotten a flu shot this year, correct?
No flu shots.
Perfect, no problem. We can get you one today. Okay, so we are going to go over some past medical history questions. Do you have or have you had in your adult life any medical conditions?
No.
Have you had any surgery since entering adulthood?
No. I was right around 18 when I had a hernia surgery.
Okay. Do you know where the hernia was located?
I'm not really sure. It was able to drop into my left scrotum, I guess.
Perfect. Did you have any complications with surgery or the anesthesia? Or any issues at all?
No.
Did you have any medical conditions as a child?
No, not that I know of.
Did you have any surgical procedures as a child?
Yes, when I was 12, my appendix, it didn't burst. I was having appendix issues and they took it out.
Okay. Anything else?
No.
Perfect. Okay, so we're going to go into your family history a little bit. Are both your parents living?
Yeah.
Both your biological parents?
No, my dad's not.
Okay, and how did he die?
Mining accident.
And do you know if he had any medical conditions?
I don't think so.
And does your mom have any medical conditions?
Yes, she has COPD. And I don't know. She has COPD and she's on oxygen.
Okay. Okay. Are either of your paternal grandparents living? Either of your father's parents?
Yes, one of them.
Okay. Do you know if either of them had medical conditions?
I don't know.
Okay, which is living?
My grandma.
Okay, and what did your grandfather die of?
Cancer.
Okay, what kind, do you know?
Don't know.
Okay. Are either of your maternal grandparents living? Your mom's
No.
parents? Okay.
No, they're both dead.
Do you know what each of them died of?
My grandpa was cancer. My grandma, I should know, and I don't. Just she was old.
Okay. And do you know what kind of cancer? Do any of your siblings have any significant medical conditions?
Nope.
Okay, so now we're just going to get into your personal history a little bit more. About how often do you exercise?
4 times a week.
Okay, and what kind of exercise are you doing?
Weightlifting and some cardio.
And what is your diet like?
It's pretty good. It's good. Trying to eat clean.
Any history of tobacco use?
Yeah.
Or in the past? Okay.
For like 2 years when I was 19.
Okay, and what form did you use tobacco?
Chewing tobacco.
Okay. And any history of alcohol use?
Yes.
Okay, how often do you consume alcohol?
Probably like once every 2 weeks.
And when you consume alcohol, is it a beer?
Yeah, really light, like a couple beers.
Any recreational drug use?
No.
Okay. Tell me just a little bit more about your lifestyle, your hobbies, and your home life.
I like to get outdoors, go hunting, hiking. I love lifting weights. Sorry, what was the question?
Tell me a little bit more about your home life. Are you married?
Yes, I'm married.
Do you have any kids?
No, just 2 dogs.
2 dogs. Great. Any issues at home?
No.
Okay, so now we're just going to go over system by system of your body. So I'm just going to be asking you a lot of questions. If any of these questions do apply to you, feel free to elaborate, whether it be now or in the past.
Okay.
Have you had any recent weight changes?
No, my weight seems to pretty much stay the same.
Okay, any recent fatigue, weakness, or fever?
Nope.
Okay, have you ever had any skin rashes, lumps, sores, itching, dryness, changes in color, changes in your hair, nails?
Yes, I get weird rashes from metal sometimes, from my belt buckle specifically.
Okay, and can you describe the rash?
Kind of looks like eczema. Just
Kind of
red and tiny bumps.
Is it itchy?
Sometimes.
Have you ever had any changes in the size or color of your moles?
Not that I've noticed.
Okay. Have you ever had any irregular or long-lasting headaches, or just any headaches that seemed odd or more significant than the normal headache to you?
Yes, I used to get them a lot more when I was younger, but I think now that I have more electrolytes, I get them less often.
Are there any certain things that trigger headaches that you've noticed?
Yeah, too much light, and just not being hydrated.
Have you ever had a head injury?
Yes, I had stitches through my eyebrow.
Okay, what happened?
I was a kid playing in a sandbox with shovels, and a different kid accidentally hit me with his shovel.
Other than the stitches, do you remember if they talked about a concussion or any other problems?
No, I was really young. I was like 7, probably.
Have you ever had any dizziness or lightheadedness?
Yes.
Okay, when do you usually notice that first?
Just if I jump up too quick, or from like major elevation changes.
Have you ever had glasses or contacts?
No, I got LASIK done a few years ago.
Have you ever had any eye pain, redness, excessive tearing, double or blurred vision, spots, specks, flashing lights, glaucoma, or cataracts?
No.
Have you ever had any hearing problems?
No.
Have you ever had any tinnitus, vertigo, earaches, ear infections, or ear discharge?
I've had a few random earaches in my life. Probably when I was sick, I don't know.
Do you get frequent colds or do you get sick frequently?
No, not really. Average.
Have you ever had any unusual nasal stuffiness or nasal discharge or excessive other than the normal cold?
Only when I've had a sinus infection.
Have you ever had nasal itching or hay fever?
Yes, I used to get hay fever when I was a kid. Not so much anymore.
When would you get it as a kid? What were the triggers?
Just when it was like hot and dry, and I think the farmers were cutting hay, and it was really bad.
Have you ever had any significant nosebleeds or sinus troubles?
No.
Okay. Have you ever had any issues with your teeth or gums, such as bleeding gums, or dental issues or procedures?
Yes, I've had a couple of teeth pulled, and my gums used to bleed more, but not so much now.
About how long ago did you have your teeth pulled?
5 years ago. Maybe 6 years ago. Something like that.
Do you know why they pulled them?
They were broken because they had cavities, and they were, I think, just too far gone to fix.
Okay. Have you ever had a sore tongue, dry mouth, hoarseness, or frequent sore throats?
I've had a dry mouth, but only because I was thirsty.
Have you ever had swollen glands in your neck?
I don't think so.
Okay. Have you ever had lumps, pain, or stiffness in the neck?
Stiffness when I'm sick, nothing else.
Have you ever had any nipple discharge?
No.
Perfect. Have you ever had any shortness of breath, wheezing, pain with deep breaths, coughs, or sputum?
Only when I'm like hiking up a mountain.
Okay, which do you experience when you're hiking?
Shortness of breath. I think it's normal.
Does it usually get better when you rest for a minute or two?
Yes.
Okay. Have you ever had any heart trouble?
No.
Have you ever had high blood pressure, chest pain, palpitations, trouble breathing at night or while asleep?
Yeah. My blood pressure used to be a little bit high, but now it's good. And I've been told that I snore at night.
Okay. Have you ever had heart murmurs or rheumatic fever?
Not that I know of.
Okay. Have you ever had any trouble swallowing, heartburn, appetite issues, nausea?
No.
Have you had ever or recently had any significant change in bowel movement pattern, size, color, or consistency?
No.
Have you ever had any rectal bleeding, black or tarry stools, or hemorrhoids?
No.
Have you ever had any issues with constipation or diarrhea?
Not continuously. Once, yeah.
Okay, is there something that usually triggers?
Yeah.
Okay, can you tell me about it?
Taco Bell. Oh, that's all. I don't know.
How often do you have bowel movements?
Twice a day.
Have you ever had any significant abdominal pain, food intolerances, or excessive gas?
No.
Have you ever had any jaundice, liver, or gallbladder trouble?
No.
Okay, have you ever had any leg pain with exertion?
Probably. With exertion, yes.
Okay. So this is going to be like as you're exercising, you have leg pain, not necessarily muscle soreness after exercising.
Oh, then no.
Have you ever had leg cramps, varicose veins, clots, swelling in the calves, legs, or feet?
No.
Okay, have you ever had color changes in your fingers or toes during cold weather?
Yeah.
Okay. Tell me about it.
I don't know. They'll get like red and pink when they're very cold. Normally they're not.
Okay. Have you ever had any muscle or joint pain, stiffness, arthritis, gout, or backaches?
No.
Have you ever had any history of trauma to the neck or back?
No.
Have you ever had any broken bones or sprains?
I have sprained my ankle.
Which ankle?
I think it was the left one. I really don't remember.
And when did that happen?
I was about 19 years old.
Okay. Have you ever had any difficulty urinating, pain or burning while urinating, frequent urination at night, urgent need to urinate, incontinence, dribbling, blood in your urine, or frequent UTIs?
No.
Perfect. Have you ever had any significant tension, anxiety, depression, suicidal ideation, memory problems, or sleep problems?
Just sleep problems.
Okay, can you tell me about your sleep problems?
If I'm not extremely tired, it's hard for me to go to bed. I just lay there and toss and turn.
Have you ever had any treatment with a psychiatrist?
No.
Have you ever had any significant changes in your mood, in your attention, in your speech, in your memory, judgment?
Sorry, will you ask that again?
Have you ever had any significant changes to your mood, to your attention, to your speech, to your memory, or to your judgment?
No, I don't think so.
Have you ever had any headaches, dizziness, fainting, or blackouts, other than the dizziness that we talked about upon standing?
No.
Have you ever had any weakness, paralysis, numbness, tingling, tremors, or seizures?
No.
Have you ever had anemia, easy bleeding, or bruising?
No.
you ever experienced excessive sweating, excessive thirst, excessive hunger, excessive urine output, or heat-cold intolerances?
Yes, when it's not that cold, my hands feel like they are frostbitten, so I don't think I have good circulation in my hands.
Is there anything else in your medical history that we haven't had a chance to talk about?
No, I don't think so.
Do you have any questions for me?
Nope.
Okay. All right. I'm going to look this over and then we will go over a few things that you have had and we will go from there.
Okay.
Okay. Thank you.